Hello, I'm Megan Homsy, and I'm a transplant social worker here at The Ohio State University Wexner Medical Center. Transplant social workers are members of every donor's medical team. When you meet with the social worker, we will complete what's known as a psychosocial evaluation, which is just a fancy way of saying I'm going to get to know you as my patient. I'm going to ask you lots of questions about a variety of different things. During your meeting with the social worker, we'll discuss your basic background information, who the people are in your life that will help you through the process of donation, your work and income, to make sure that being a donor isn't going to place too much of a financial burden on you. We'll talk about your mental health, including any current symptoms or matters you may have been treated for in the past, your current and past alcohol and substance use, your motivation for being your donor, because I want to know your story about how you decided to help your loved one in such an incredible way. And finally, your understanding of the donation process, along with the risks and benefits of being a living donor. As a social worker, it's my job to make sure that you're making an informed and educated decision about being a donor, and that means being aware of the risks associated with donation. The non-medical risks associated with being a living donor include body image, because after surgery, you'll have a scar, and some donors describe feeling differently about their body because of that scar. Financial strain and potential impact on your job. Being a living donor will involve a period of absence from your work, and as the living donor social worker, I can help you explore options and potential impact donation may have on your employment status. Disruption in family obligations. While you recover from your donation surgery, you'll have limited ability for things like driving and lifting, which means if you're a caregiver for someone else, such as small children or elderly relatives, you're going to be limited in what you can do for them during this period, so it's important to plan ahead for this. Substance abuse relapse. If addiction issues were a problem for you in the past, surgical recovery can sometimes increase the risk of relapse. And if pain management was an issue for you, that can be difficult after a surgery as well. Relationship changes. Some living donors describe changes in their relationship after donation, both with their family and friends and with the recipient of the organ themselves. Mood disruptions, because after any surgery, but also especially after being a living donor, it's not uncommon to experience an increase in either depression or anxiety or just not feeling like your normal self. And finally, the impact on future insurability. While you may have insurance now, sometimes the process of being a living donor can change if you apply for a new insurance or insurance policies, and we can help with that. Keep in mind, the majority of donors experience few, if any, of these risks, but the best way to prepare for anything is to know ahead of time and educate ourselves about them. Studies have found that living donors spend an average of $5,000 related to the donation process, and while your surgery, the evaluation, and any follow-up appointments or medications you may be discharged on will be paid for by your recipient's insurance, that $5,000 that most donors spend related to being a donor, that comes from variety of daily living things, because you won't be working, the cost of a hotel, flying, if you're parking or things like that, meal vouchers, all that kind of stuff that adds up. Your transplant social worker will be able to provide you with information on the various resources available to potential living donors to help offset some of these expenses. These resources include applications for need-based financial assistance through nonprofit agencies such as the National Living Donor Assistance Center, fundraising techniques, and organizations which can assist with this process so that you don't incur any fees or difficulties with the money you raise, support groups and online communities such as Living Donors Online, and finally, your social worker can assist you in navigating possible resources available through your employer's human resource department, as some employers provide living donation-specific paid leave and other benefits.